So I was brought into this booth and separated by a clear glass window. And I was listening so hard because I wanted to hear those beeps. I wanted so badly for my hearing to be normal. The audiologist came onto the speaker and told me to only raise my hand when I hear beeps. So I concentrated even harder. And I swear I really did hear beeps. So I just kept raising my hand. I began to hear more and more agitation in her voice when she came onto the speaker. And she told me, young lady, she said, young lady, hearing aids aren't as fun as you seem to think they are. I felt misunderstood and crazy. I didn't go back to the audiologist for another 20 years. This is 1 in 5, stories that explore disability in our lives, our neighborhoods, and our health systems. I'm Angela Marith. I'm the Chief Administrative Officer in Population Health at Providence.
And I'm Sarah Quinto. I'm the co-chair of the Providence Disability Employee Resource Group. At least 1 in 5 people has a disability. You know people with a disability. Some of those conditions are clearly evident and some are hidden. We are going to discuss why we are better with disability in our communities and how welcoming its presence can strengthen health for all.
We're storytellers dedicated to bringing you the voices we need to hear to make a more equitable health system. And we're proud to work at Providence, one of the largest nonprofit health systems in the country, who cares deeply about eliminating health disparities, including those experienced by people with a disability. We'll welcome providers and patients to discuss experiences receiving health care and how we can do better.
And you can be part of the storytelling. Let us know your experience accessing healthcare with a disability. Go to providence.org/1in5, words spelled out, 1 in 5. We'll repeat the web address at the end of the show as well.
I know that there are so many stories that people are ready to share. We have a lot to look forward to in the episodes ahead. We've pulled just a few of the voices of people in the podcast, people talking about their experiences accessing healthcare with a disability. Let's just listen for a minute to the range of experience that's represented here.
When I talk with other people with disabilities, they often say, and we often agree, that we will probably die from something that would have been easily treated had we been able to get treatment.
I finally found a home where I can focus on accessibility for digital content. Because I'm nearly totally blind. We need equal access for everybody, and I'm so uniquely qualified to serve in a role that raises awareness about accessibility.
Don't assume that all people with disabilities are suffering from their disabilities. Don't assume that all people with disabilities want a cure for their disability.
And that concept that disability didn't have to be something negative and it could be neutral or even a positive piece of someone's identity really kind of blew my mind at the time. And it put me on a track that led me on a pretty radical journey of self-acceptance, advocacy, and education to become the person that I am today.
You know, in listening to those quotes, Sarah, what comes to my mind is that I didn't know until I started recording these episodes that saying nothing about me without me actually came from the disability community.
Yeah, it actually originated in South Africa as part of the apartheid movement and the disability community's rallying cry there. Listening to those clips, I think this is so different than the traditional narrative that you hear about disability. It's powerful, it's strong, there's no pity in it. It's really this piece of, hey, we're here and we have rights and we should be treated with dignity and we should be included and listened to.
So, Sarah, where do we even start in thinking about healthcare disparities for people with disability?
Not long ago, Dr. Devin Stahl, a bioethicist and religion scholar, offered a series of presentations on healthcare for people with disabilities for our employees at Providence. Let's listen to a couple of minutes of her remarks.
Of course, we know from lots of good empirical work that people with disabilities in our communities experience significant health disparities. And this is, I'm gathering a lot of this data from an NIH report that came out last year. People with disabilities are far more likely than the non-disabled to report that they experience fair or poor health, 40% versus right around 10%. So they are not happy with the state of their health. And part of this is because they're much less likely to receive preventative care, including really essential care like mammography, pap smears, dental visits. I just saw a study from the Special Olympics that said when the athletes gathered for the last Special Olympics tour, they were all given physical exams and almost half of them had obvious tooth decay. So people are not being taken care of. They're not getting the kinds of preventative care that they need. And as a result of not getting the right kinds of preventative care, people with disabilities are much more likely to die from things like cancer. Makes sense. If you're not getting your annual screenings, you're not catching cancer quite as quickly. And they're less likely to get timely, high-quality care due to a lack of accessible medical facilities and examination equipment. So exam tables that don't move, weight scales that can't accommodate a wheelchair, mammography that can't also move down to a wheelchair, as well as a lack of interpreters and individualized accommodations.
That was Dr. Devin Stahl speaking to Providence caregivers during the 2024 Goldman Berlin Lectureship in Palliative Medicine. This was hosted by the Providence Center for Healthcare Ethics. Before we go, we want to introduce you to two other voices. Jeff Cato is a caregiver at Providence who focuses on accessibility for online content. And Erik Wexler is our former Chief Operating Officer and incoming Chief Executive Officer at Providence. The two of them sat down recently to talk about Jeff's work at Providence. Their discussion was recorded as part of the Hear Me Now storytelling initiative. Here's part of the conversation.
It started as a summer work experience program in my local area. There was a nonprofit organization assigned with basically getting high school students opportunities, people with disabilities. I'm nearly totally blind. And so I started on again, like a 3-month summer work experience program. And when that ended, it was funny because I happened to be in one of the supervisor's office, and one of the nice supervisors said to me, "Gosh, we're going to miss you around here. You've done a really nice job for us." And I said, "Well, I'm going to miss you guys too, but you could always hire me." And it's like a light went off. It's like, gosh, we never thought of that. Maybe we could do that. So long story short, I got hired on, and I have evolved over the years, over the past, especially 7, maybe 8 years. I finally found a home where I can focus on accessibility for digital content, because that's our front door. That's we want everybody to be welcome and come in and be able to access our content, make appointments, pay bills, do everything that they need to do. We need equal access for everybody. And I'm so uniquely qualified to serve in a role that raises awareness about accessibility. And so the Providence took a chance on me, is the way I look at it. They took a chance on somebody who was unproven, limited skill sets in certain areas. And honestly, I was a person who, growing up blind, was told you'll probably never have a real meaningful job anyway in the world. So try to learn as much as you can, try to have as much fun as you can, but you're probably going to live off the government for the rest of your life.
Well, I think you took a chance on us. And you gave us that gift on that day when you were working in dietary, turning to your colleagues and saying, "Hey, hire me." And by having that moment of clarity, here you are so many years later with so many contributions. Can we just take a step back for a minute? Do you ever find yourself getting frustrated that we're just not moving fast enough?
For me, it'll never go fast enough.
That's Jeff Cato, a caregiver here at Providence who focuses on the accessibility of digital content. He was talking with Erik Wexler, our Chief Operating Officer. We'll hear more from their conversation in episode 5. We're eager to hear from you. Our web address is providence.org/1in5. That's all one word spelled out, 1 in 5. Many thanks to our guests today, Dr. Devin Stahl, Jeff Cato, and Erik Wexler. Thanks also to our colleagues Scott Acord, Deepak Sadagopan, Sean Collins, and the Disability Caregiver Resource Group at Providence. I'm Angela Marith.
And I'm Sarah Quinto. Join us for our next episode when we explore what people with disabilities would like their healthcare providers to know. Thanks for listening. This is 1 in 5.